So good morning, everybody. So sorry for the technical difficulties, but trying Zoom and Facebook Live at the same time didn't seem to work this morning, but we're going to get this out to everybody. So I apologize for that, but thank you for joining us. I'm Courtney Galley with Lone Star Family Health Center, and so excited that we are joined with MD Anderson Cancer Center to talk about breast cancer in celebration of October's Breast Cancer Awareness Month. So our presenter this morning is Dr. Toma Omofoye. I was working on that name for a while this morning. She is an associate professor in the Department of Imaging at the University of Texas MD Anderson Cancer Center in Houston, Texas. She graduated from the University of West Georgia with summa cum laude honors. She completed medical training and diagnostic radiology at Duke University, where she was inducted into the Alpha Omega Medical Honor Society and served as chief resident. She joined MD Anderson for breast imaging fellowship, and upon its completion, she became a member of the MD Anderson faculty. Dr. Omofoye sees patients primarily at MD Anderson, the Woodlands, Houston area location, where she intercepts breast imaging studies and performs imaging guiding procedures. Her research interests include 3D mammograms and novel educational methods. She has a passion for global health and education. Thank you for joining us this morning. Sorry about the technical difficulties.
Good morning, everyone. Thank you so much for having me, Ms. Galley, and thank you to Lone Star for creating this opportunity for us to come together and talk about breast health.
Yes.
All right, we'll get started, okay? I'll start by sharing my screen. Okay, I believe everyone should be able to see my screen now.
Yeah.
Wonderful. Good morning. As was just mentioned, my name is Dr. Toma Omofoye. Most patients call me Dr. O, and that's fine as well. Thank you all for inviting me here for the presentation. I think it's wonderful that we have the opportunity to have these virtual presentations, and I want to let all of our listeners know that if you have any questions, you can either add them in the chat, you can put them on the Lone Star page, or even just reach out to us at the end. We'll include our email address so that we can be contacted, because we really would like an opportunity to get you answers to your questions. So we are living in pandemic times, so I just want to take the opportunity to remind everyone that even though people may not be talking about it as much, it is important to remember that there's an ongoing pandemic. Please get vaccinated and encourage your friends and family to do the same. It is one of the best things you can do for your health right now. Do wear a mask when you're out in public. Try to stay 6 feet apart from people who are outside of your immediate household and avoid crowds. Wash your hands as often as you can. And if you think that you have been exposed or if you are showing symptoms, please get tested so that we can try to control the spread. Okay, do remember that everyone over the age of 12 at this point is eligible for a COVID-19 vaccination that is available free of charge. If you are interested, MD Anderson does actually provide the vaccine by appointment only by going online to mdanderson.org/vaccine to register. So let's start by talking about some basics about cancer, okay? Cancer is not a single disease, but it is a group of more than 100 diseases that occur when you see uncontrollable growth of tissue cells. When these cells build up, they become an abnormal mass called a tumor. Now, a tumor can actually be benign or malignant, okay? Benign tumors can cause problems because they grow large and cause local effects like pain or lumpiness, but they typically do not spread, but they can be removed surgically. The malignant tumors are more worrisome because in addition to growing large and causing local issues, they have the opportunity and the ability to metastasize or to spread to other parts of the body and cause problems in multiple different areas. And that is the reason why the malignant tumors are considered a threat to life. Let's talk about the breast. So the breast is on your chest muscle, and it is made up of different parts. First, there are about 15 to 20 different lobes in the breast. Each of these lobes contain lobules, which produce milk. This milk flows through the milk ducts all the way to the nipple. The nipple is in the center of a dark area in the center of the breast called the areola. The lobes and lobules in the breast are separated by fat that's interspersed between them. In addition, there are lymph vessels that drain fluid out of the breast towards these small round organs called lymph nodes. Those lymph nodes can sit at different stations around your breast. They may sit at the underarm, they may sit around your breastbone, they may sit around your collarbone as well. Those lymph nodes can trap bacteria or cancer cells, and in that way, they may be involved with issues that are happening in the breast. So here's a question for you to think about. Do you think that breast cancer is the most frequently diagnosed cancer in women? The answer is true. Breast cancer is now the most frequently diagnosed cancer in women, and that's why we have to spend wisely our opportunities to talk about it. Let's talk about some of the warning signs of breast cancer. Mammograms are a very important way of detecting cancer early. And mammograms often detect cancers before they can be felt or seen. But we want you to be aware of the symptoms that you should look out for to encourage you to take charge of your health and to speak up to your doctor and to request a mammogram at that time. Symptoms to look out for. Look out for a lump in the breast or a lump in your underarm. So if you have a lump in the breast or a lump in your axilla, we like to call it, or your armpit, those may be signs of breast cancer. If you see changes in the size or in the shape of your breast, or the skin of the breast starts to dimple or pucker, sometimes people may see swelling in the skin of the breast that's so profound that the skin of the breast starts to show the pores really well, and it looks like the pores of an orange. If you see scaliness in the breast skin, especially around the nipple, it looks almost like an eczema rash, but it doesn't go away with just cream. If you see changes to the nipple where it changes direction or it pulls to one side or even completely pulls inside of your breast, those may be signs of breast cancer. If any of these signs are occurring and have lasted longer than 2 weeks, it's important to talk to your doctor about having that checked out. With the pandemic, some women have been more hesitant to go to hospitals and healthcare systems because they're nervous about exposure to COVID-19. But I want to reassure you very clearly that we have put a number of steps in place so that we do not have any exposures in our facilities, and we want you to be healthy but still come in and get your breast exam performed. So just as cancer is not a single disease, similarly, there are different kinds of breast cancer. The most common form of breast cancer is ductal carcinoma. This is a cancer that forms in the milk ducts of the breast. Lobular carcinoma is a cancer that occurs starting in the lobules of the breast. There's another form of cancer, which is called a triple negative breast cancer. It's a more aggressive form that is sometimes seen more commonly in young women or in Black women, and this requires special treatment. You may have also heard of something called inflammatory breast cancer, which acts like an infection. Women will complain of having redness, warmth to the breast, swelling that's rapidly progressive. If this occurs and you think you may have a rash or redness or swelling in the breast, please bring it to the attention of your physician as soon as possible and be checked out at a breast facility. About 1 to 5% of breast cancers in the United States are inflammatory breast cancers. Here's another question for your consideration. Do you think that breast cancer can occur in young women? It's true. Breast cancer can and does occur in women of all ages. And so it's important for women of all ages to know about breast health and ways to prevent breast cancer. Am I at risk for breast cancer? Is a question that we get very frequently. No one can say if you will get breast cancer, but there are factors that may increase the risk of disease. So if you have one or more family members who have had breast cancer and or ovarian cancer, you may be at increased risk of breast cancer. If you have personally received radiation therapy to your chest between the ages of 10 and 30, and I'm talking radiation therapy that usually occurs in the setting of a cancer, like a thyroid cancer, for example. If you have had a breast biopsy that diagnosed breast disease that was called a high-risk lesion, such as atypical ductal hyperplasia or in situ disease. Another set of factors that can cause the risk for breast cancer to be increased are the reproductive factors. So that means that if a woman had menopause after the age of 55, or she started her period before age 12, if you had your first child after the age of 30 or never actually had a pregnancy, those are some of the factors which, if you see two or more of those, can increase your risk of breast cancer. Now that we've learned a little bit more about breast cancer, let's talk about some of the actions we can take to reduce the risk of getting breast cancer. It is very important to stay lean after menopause. Weight control and weight management are important throughout your lifetime because it does reduce the risk of breast cancer. But similarly, it is important even after menopause to continue to maintain a healthy weight. Eating good, nutritious meals, including a lot of plant-based meals in your diet, can help to reduce your risk of breast cancer. And in fact, they also strengthen your immune system in such a way that you're able to better fight other diseases such as COVID-19. It is very important as women to get active and to sit less. Sitting too much can increase our body fat, which increases our risk of breast cancer and other diseases. The goal, okay, because this is what we get asked, is how much exercise should I do? The goal is to aim for 150 minutes per week of moderate exercise. So that's if you're walking. If you're doing more strenuous exercise, aim for about 75 minutes per week. Strength training is also beneficial in helping to maintain a healthy weight. People have gotten a lot of conflicting information regarding alcohol, but let me be clear. It is very important to think that if you're trying to reduce your risk of breast cancer, you have to make the effort to avoid alcohol. Not drinking alcohol is the safest choice that you can make. And if you must drink, try to reduce it so that you're having less than one drink per day. Drinking alcohol can have many disruptive effects, such as disrupting your sleep and even having negative effects on your immune system and ability to fight diseases. As much as is within your power, I like to encourage women to choose to breastfeed. Breastfeeding is ideal for moms as well as babies. For women who are breastfeeding, attempt to breastfeed exclusively for 6 months or more. By breastfeeding exclusively for 6 months, and continuing to breastfeed even after introducing other meals into the baby's diet, you can reduce your risk for breast cancer. It's very interesting the way the body does this, because the process of breastfeeding causes women to shed some breast cells. And some of those cells may be cells that have damaged DNA that could have a potential to turn cancerous later on in life. So by shedding some of those cells and replacing them with fatty tissue, you're able to reduce your risk of developing breast cancer. But breastfed babies, it's been shown, are also more likely to have a healthy weight in their lifetime. So you may also be giving your baby a better chance of not developing cancer in their lifetime as well. I want to emphasize that one of the best things that you can do to reduce your risk of getting breast cancer is to talk to your doctor. Women at increased risk of breast cancer may need to have certain medications or medical exams or testing to be able to best keep them healthy. So if you have one or more of the risk factors that we've discussed earlier, it's important to talk with your doctor. Here's another item for you to think about. Do you think that a woman can develop breast cancer even if she has no family history of the disease? That is true. I see your thumbs up. In fact, most women who are diagnosed with breast cancer have no family history of the disease. 85% of women who are diagnosed with breast cancer have no family history of the disease. So this is information that applies to every one of us, not just those people who have a known family history of breast cancer. So genetic counseling for breast cancer is one of the things that we have seen offer women the most personalized information about their health, their risk factors, and recommendations to maintain healthy. A genetic counselor sits with you to review your medical history, and then they perform a detailed health assessment. Based on that health assessment, they may recommend blood tests and genetic screens, which provides information on genetic mutations, such as the BRCA1 or BRCA and BRCA2 gene mutations that are shown to have high increase in risk of breast cancer. What are some other preventative measures that can be taken on? Well, if you are at higher than average risk of developing breast cancer, you may actually be eligible for some medications such as tamoxifen and raloxifene, which can reduce your risk of breast cancer. This is something that I'm very proud of our ability to offer at MD Anderson. Some other preventative measures that women can take is to undergo mastectomy of one or both breasts prior to developing breast cancer, and that's called a prophylactic mastectomy. It's another way to reduce risk for the women who are at higher than average risk of breast cancer. And these are some of the options that you can discuss with your doctor depending on your personalized risk assessment. Here's another question for your consideration. Do you think that treatment is more successful when breast cancer is detected early? I see the thumbs up. That's true. In fact, 99% of women with early stage cancer and 86% of women with breast cancer that has spread to nearby lymph nodes are treated successfully. This underscores the importance of why we have to detect breast cancer as early as possible. This is part of why we recommend that women at average risk of breast cancer begin their screening mammography every year, starting at age 40. Breast awareness is something that I want you to take away from this presentation. We at MD Anderson are really emphatic about encouraging women to be aware of their breasts. Know what feels normal for your breast and know what looks normal for your breast. A lot of women have been intimidated by the idea of performing a breast exam because they don't know how to do it or what to do. But breast awareness is really just about understanding your normal, okay? So if there are any changes, like we talked about, where there's lumpiness, no matter how you notice it, in the shower or from a partner, if there's discharge from the breast, if the nipples are turning or retracting like we talked about, if you're seeing changes to the skin of the breast like puckering or swelling, please report these symptoms to your doctor if they have persisted for longer than 2 weeks. Now, let me see you give a thumbs up if you think the mammography is safe. Yes. Many women acknowledge the mammography can be uncomfortable, but while mammography can be uncomfortable, it is not at all harmful to your breast. Modern mammography uses very low dose X-rays to produce a high quality image, and it does not damage your breast in the process of doing that. The dose of radiation from a screening mammogram is about the same exposure that you get even just from being on the Earth's surface for an average of 3 months. are about the same dose you would get from a cross-country flight. So it's a very low dose of radiation, and I don't want that to deter anyone from obtaining a mammogram. Let's talk about mammography. So a screening mammogram, shown here, is when we use a machine to take X-ray pictures of the breast. Screening mammograms are the mammograms we perform in women who have no symptoms. They're just coming on an annual schedule. For women who have particular symptoms that they're worried about, we also start, in most cases, with a mammogram, but that's called a diagnostic mammogram, where we're troubleshooting the area that you're concerned about. 3D mammograms look very similar to you as a regular mammogram. It looks like the same machine, the same setup in which a woman puts her breast on the mammogram table and it's compressed gently between the plates. And then after a few seconds, the machine takes a picture. They have taken 2 pictures on average of each breast using very low dose X-rays. In the 3D mammograms, we actually take a series of very quick pictures of different areas of the breast and reconstruct it into an image that allows us to see more detail in the breast. We strongly recommend that any woman who is obtaining a mammogram obtain a 3D mammogram because it allows us to both detect cancers earlier at smaller stages, but it also helps us to detect areas that could be tricky, that could have potentially necessitated a callback, but are not in fact cancers. So you see more sensitivity. We're more able to find the real cancers, and we're less likely to call you back unnecessarily if you're getting a 3D mammogram. We like to advise women if they're coming for their mammogram appointment to wear 2-piece outfits, so a top and a bottom, so that you can easily remove your shirt. But throughout the entire process, our technologists will do everything that we can to keep you very comfortable, and you can be in and out after obtaining your mammograms within about 20 minutes. Are there other tests that I may need? Many women who are emphatic about taking care of their breast health wonder about whether a mammogram is necessary or a mammogram is enough. The truth is that the mammogram is our first-line test, so we recommend that women above 40 all get a mammogram. But in addition, if you are at higher risk, you may require additional tests, such as an MRI or an ultrasound, in addition to that annual mammogram. This occurs sometimes for women who have denser breast tissue. You may benefit from additional ultrasound every year. MRI is sometimes performed annually for the women who are at high risk of developing breast cancer due to family history, their personal history of high-risk lesions, and some of the other factors that we talked about before. As we discussed today, there are many things that you can do to help reduce your risk of getting breast cancer. And while it's important to recognize the signs and symptoms of a potential breast cancer, the best benefit comes when we can detect that cancer on a screening mammogram before that cancer can be seen or felt. So I want to encourage everyone to get their screening mammograms, which are available at MD Anderson, where we have 4 locations throughout the Houston area. One at the Texas Medical Center, in the Woodlands, at West Houston, and at Lee City. And you can schedule your mammogram on your own time online by going to mdanderson.org/mammogram or calling the number on our screen. It is safe, I want to reiterate, it is safe to get your mammograms even during the pandemic, as long as you're not having any symptoms on that particular day and have not tested positive. Mammograms at MD Anderson are read by specialists who are in breast imaging, and for many women, we're able to provide a real-time read of their mammogram results and give them the answer that day. That is something that a lot of women have indicated has helped to reduce their anxiety. We even have the ability to see women for screening mammograms on Saturday. And so if you have many commitments during the week and are unable to make it during the week, Saturdays are definitely an option, and I would encourage you to consider that. If you were to have a lump or other symptom, in addition to the screening mammography services, we provide diagnostic mammography services at all of these locations. We also have our undiagnosed breast clinic, so we have clinicians here on site who are able to perform your physical exam, recommend tests, and provide counseling for next steps. And they are associated with our undiagnosed breast clinic. And an appointment can be made with them at 713-563-5360. Just a little plug here. On Saturday, November 6th, MD Anderson will be hosting a virtual boot walk to end cancer. For this event, people around the world, virtually, with their families, will be walking 1.2 miles around their neighborhood. This is one of the things that we do yearly in order to raise money to support families going through cancer with all sorts of accommodations if they're in clinical trials, sometimes housing benefits, and other things that they may need. So if you're interested in joining, please go to mdanderson.org/bootwalk to register. Thank you all for the opportunity to talk with you all today. If you have any questions, then we are happy to answer them. You'll have access to our email, that of mine and my colleague, and we will be happy to try to answer any questions that you may have. On the other hand, if you want to come ask the questions in person at the time of your screening mammogram visit, you're welcome to make an appointment and come see us at MD Anderson at the Woodlands location. And I would be happy to address any questions you have, especially about your personal breast health. Thank you all so much.
Thank you so much, Dr. O. Just great information. I have had the privilege of hearing your presentation before, but I have some other questions kind of popped into my head as you were presenting this morning. And I think this might be a question that a lot of people have just because we're going through COVID. But if people are concerned about getting vaccinated or worrying about coming in during the COVID time, I know you touched on it a little bit in the beginning, but what would you tell people who may have a little bit of hesitation of getting the vaccine while they have breast cancer, or coming in to get some to get a checkup or to see kind of what's going on?
Yeah, I think that's a great question. So for everyone who enters our buildings, we have a lot of protections in place. This is for our staff, for our faculty, and for patients, right? So we're performing temperature checks. We are performing screening so that we're trying to minimize exposure to anyone who's had that an exposure to COVID. We have everyone is masked and with full PPE so that everyone that you interact is being safe so that we can keep you as safe as possible. So our buildings are safe. Now, in talking about the vaccine is absolutely one of the most important things that you can do to reduce your risk of getting COVID-19, or at least getting severe disease and hospitalization. For people who have yet to get their vaccine, I strongly encourage you to go ahead and schedule both. Schedule your mammogram, come on in and get it now, and schedule your vaccine as well. I would typically say try to get the mammogram before the vaccine, because the process of getting the vaccine, and I think that's what you were getting at, Ms. Gowie, is the process of getting the vaccine, it can sometimes cause your lymph nodes to swell. Yeah. And so if you get the vaccine and your lymph nodes are swollen, it can show up on the mammogram images, and the person interpreting it, me and my team, look at that and go, oh, why is that a little bit swollen? Is this from something else, or is this from breast cancer? So if for some reason the timelines overlap, you got your vaccine before you got your mammogram, go ahead and let our technologists know when you're doing your mammogram, okay? Tell them the dates that you got the vaccines and the arm you got the vaccine in, so we can more easily kind of clarify whether we think those lymph nodes are swollen from the vaccine or they're swollen from something else. if you're able to space them out, so if you've already obtained your vaccine or you've potentially already obtained your booster, I would say wait 6 to 10 weeks or so before you get your mammogram, just to reduce that overlap in the appearance of the lymph nodes. For people who have been diagnosed with breast cancer, we do still recommend the vaccine even after thorough examination of the data by our experts here at MD Anderson. But if you have been diagnosed with breast cancer recently, you're undergoing treatment at this time, we recommend that you get your vaccine in the arm opposite to where your breast cancer was diagnosed, so that it just helps to clarify the lymph node issue. Some people have also gotten their COVID vaccine in their lower body. So in the muscles of your thigh, again, all of this is just as a way so that when those lymph nodes react, which we want them to do after you get the vaccine, it doesn't cause any confusion with the lymph nodes in the upper body that we can see sometimes swell with breast cancer. So we have all kinds of tips and tricks to work on this. And thank you for giving me the opportunity to talk about that.
Yeah, I had, that had come up with me earlier in the year when I was due for my mammogram and about my vaccine. So I think that's some great information to let people know that there is a recommendation of a period of getting your vaccine and having your mammogram. I know we have some other questions, but I have one more.
Okay.
So, and it may be kind of a broad question, but what can healthcare workers or just the general public help to convey in our community about early detection? Because of course, as we know, and as you have stated, early detection is the best way to be a preventative. And I think a lot of people, in my age group, I'm 45, think that, oh, it can't happen to them. My best friend was diagnosed last year and she's 44. So no history of breast cancer in her family. Thank God she is in recovery. But, or what are some kind of fears, I guess, of women that we can, try and help as advocates for prevention of breast cancer?
First of all, I'm sorry to hear about your friend. I'm glad that she's doing well.
Yes.
This is a question after my own heart. Okay. So are you ready? Number one, okay, there has been some confusion for women as to when to start screening. Some people have heard 40, some people have been told 50, because some of the national organizations have wavered a little bit on that. But I want to be very, very clear. The latest age that a woman should start annual screening is at 40. That's the latest age, okay? Because all of those organizations all acknowledge that the most lives are saved when screening mammogram annually for average risk women begins at age 40. They all agree that that saves the most lives. There's little fine details about why they recommend X versus Y, but the most lives are saved when we begin at 40. And like you acknowledge, you have this very close, your best friend for who was diagnosed in her 40s. I'm glad that she didn't wait till she was 50 to get her first mammogram. That would have given too long for that to grow. So that's the first thing. The latest age you should begin screening as an average risk woman is 40. The second thing is this. Some people may need to begin screening mammography earlier than 40. There are some women for whom we begin screening in their 30s. So people who have a very strong family history, people who have one of the gene mutations, in addition to the BRCA genes, there are additional genes, Lynch syndrome, the P53 genes, all of those. So there's additional genes for which we recommend screening even earlier. We recommend screening earlier too, because if you have family members, close family members diagnosed with breast cancer, we would recommend the women in that family tree to begin screening 10 years earlier than the youngest person diagnosed. So for example, if you know somebody who was diagnosed at 45, their female relatives would have to begin screening at age 35. So screening mammography starting at 40 for average risk women is the oldest age. But for many women, we actually see additional benefit prior to that. Okay, number 3. I told you this was one of my favorite questions. I love it. Number 3, the signs for breast cancer in women are the same signs for breast cancer in men. But a lot of men do not come to breast cancer prevention talk. They don't know. But breast cancer, even though it's less common in men, it definitely occurs and it has the same signs. And unfortunately, when breast cancer is diagnosed in men, it's often diagnosed at later stages because it was not recognized and because they're not undergoing routine screening. We're not recommending routine screening in them, but their symptoms definitely need to be addressed as soon as possible. So all the information that we teach you, wonderful ladies, about signs and symptoms to watch out for in the breast, that applies to every man that you know and love. And so if you see those changes in a man, it can be breast cancer as well. And more in the news now, we have some famous male celebrities who've come out and said, oh yes, I battled breast cancer and I lived with this. And I'm glad to see that because it's important for men to know that this is something that affects them as well. But it's also important for women to be on the alert, for the men in their lives to know, if these things are going on, we need to take you to go and see a doctor.
Yeah.
Okay, number 4. One of the more common reasons that we see that women do not come in for annual mammography is anxiety. And I get it. It's anxiety because you're thinking of all the people that you know who've been diagnosed and all of that kind of stuff. So I'll say 2 things to that. The first is this. The buddy system works beautifully. Almost every week, I have another situation where it's a buddy system, 2 sisters coming together, 2 best friends coming together, and you'll end up having to diagnose one of them. But they always will turn to their buddy and say, thank you for making me come this year, right? So it's one of the most beautiful ways to reduce anxiety is having that buddy system. The other thing is to realize that the breast cancer that is found by screening mammography is a very, very different entity than a late-stage breast cancer. A breast cancer found by screening mammography is typically found very small. We found some cancers that are stage 0. It's barely just starting to do what it wanted to do. And when those cancers are found, the treatment for them is much shorter, much less grueling than the treatment for the more advanced cancers. And so a lot of the time when people are anxious, it's because they're thinking, oh, I know what XYZ person went through and how hard that was to watch. But a lot of advances in treatment mean that not everyone is having to have that grueling treatment. And it also means that we have advances in detection, so we can detect things much sooner. And if they're treated much sooner, it's less grueling, and we see a much more positive success rate and survival rate. So the survival rate for a very early screening detected cancer is greater than 90%, right? So don't have this anxiety of this big, hard, harsh thing. It can be much easier. I'll tell you a personal story. With permission of the patient, someone reached out to me and said, a few years ago, you all found my breast cancer when it was at 0.4 centimeters, a 4 millimeter dot.
Wow. And
she has gone on, she's way past treatment. She's 2.5 years out now, just enjoying her life. 0.4 millimeters is how small that was. And she was just so thankful because she had kept up with the screen. It was found so early. Her treatment was a shorter course, and she's healthy. So it's a very, very different disease when it's found early versus what's found later. But even for the women who are living with later stage disease, who are living with stage 4 disease, there continues to be a lot of research. There continues to be a lot of advances. Women are living better longer. Okay. And all of that is because that community in healthcare takes this disease seriously. We take your anxiety seriously, and we're doing everything we can to address it.
Yeah. Oh, that was wonderful. I think you hit some additional points as well too. So, Kendra, do we have any further questions? I hate to take up all the time with my questions.
Actually, I have a question. Can you touch a little bit about, and I've seen a lot of research lately about alcohol consumption and how that increases your risk. Can you touch on that about like why that happens or how it happens?
Yeah. So some of this will be speculative, but I'll tell you the part that we know. What we know is that we are seeing this increase in risk based on alcohol consumption. That's there. There is this States, we have seen how alcohol can decrease the strength of your immune system. Like maybe your immune system is just not as good at fighting off anything. It's not as good at fighting off infection. It's not as good at fighting off cancerous cells, when they're in their early stages. So maybe it's just that. So that's one. Number two, it could be that because of alcohol, we'll often see a lot of weight gain and nutritional deficiency, right? So then you start maybe becoming susceptible to that weight connection, that obesity connection to breast cancer as well. Then number three, the nature of alcohol, especially heavy alcohol consumption, is that often it gets tied to poor sleep. And once you tie it to poor sleep, you start talking about poor exercise, poor activity, so it all kind of snowballs. So that in some ways, it's probably one little arrow that causes all of this downstream domino effect. So the connection is clear. And I'm glad you brought this up, Kendra, because there's sometimes socially a pressure to drink. And in fact, socially now, there's this whole mommy wine culture, lots of mommy, mom juice and all that kind of stuff. And it's very socially acceptable. And I don't want to make anyone feel bad about it, but I just want everybody to be aware, just a little bit more aware. Do I really need this? Do I have to have, alcohol at the end of the day because I had a bad day? Just be really aware, because it's becoming such a slippery slope. And we don't want to have any more cancers being diagnosed that could have been prevented.
Thank you.
Yeah, that was a great question.
Can I add one more thing, if that's okay?
Of course, yes, please.
Yeah. Sometimes we also see things on the other end of the spectrum, where women who have had negative mammograms for many, many years will say, well, my mammogram's always normal. I don't have to go anymore. So I want to encourage women to know that the risk of breast cancer doesn't actually go away. In fact, it kind of increases over time. It increases, there's a steep rise as you go into your 40s, but there's also just this cumulative risk that's always increasing over your lifetime. So even for women who are in their 70s and in their 80s, there is a risk of developing breast cancer. But even in those women, we find that a screening detected cancer can be treated very successfully, and for most of those women, treated in such a way that they can go on to live the rest of their lives healthy. And so for women who are living well and living well longer, please continue to include this as part of your health checkup so that we can continue to maintain your health for as long as possible.
Yeah. Oh my gosh, this was so great. Again, I have like 20,000 questions running through my head. And I've seen your presentation before. It's been wonderful, but I want to be conscious of everybody's time here. And thank you so much. This was so great. I do want everybody to know that we're going to be doing a Spanish version of this presentation, October 19th with Patricia, who has joined us today. So, and just encourage anybody. Hi, Patricia. So we'll see her. We'll see her in a couple of weeks. But I just want to encourage anybody, if you have any questions, I'll put some information and emails down when we post this on Facebook and on our YouTube page. You can contact me too directly or send us a direct message and we'll get your questions answered. I won't have the answers, but I'll make sure we get the answers for y'all. But on behalf of Lone Star Family Health Center, thank y'all so much. This has been, I think, just a treat for us to be able to do this and share it with the community. And, early detection is always great. And, us at the health center, we're glad to help in any way we can with that.
Thank you so much, Lone Star Family Health Center. We're just really honored to have been invited and eager to keep a conversation going. So we're not joking about those questions. We really will get some answers to you.
Definitely. Well, thank y'all so much. Appreciate it.
Thank you
so much.
Get your mammogram.
Bye.
Yes, thank you so much. Bye, everyone.